Treatment issues. The first challenge in treating amok lies in understanding how its causes and interpretations have evolved over time. As Joyce previously noted, these shifting perspectives complicate efforts to address it effectively. This evolution prompts a critical question. Is amok truly a culturally bound syndrome, or does it transcend specific cultural contexts? Could it instead reflect broader societal issues, taking on different forms depending on the time and place? While cultural influences undeniably shape its expression, could a muck ultimately represent a human phenomenon that's universal, manifesting uniquely across eras and societies? These evolving interpretations are central to the understanding of why treating a muck remains so challenging. Its causes aren't fixed, they require treatment approaches to evolve alongside our growing understanding. Whether examined through a religious, psychological, or sociocultural lens, amok endures as an enigma, a mirror reflecting the intricate complexities of human behavior. Cultural barriers. Cultural barriers to mental health treatment in Malaysia are a major roadblock, as Raj et al. 2021 points out. It's not just about misdiagnosis, there's also a deep seated stigma and a strong preference for traditional healing practices that keep people from seeking the help that they need. Misunderstandings about mental health run rampant, and this lack of awareness makes it incredibly difficult for many individuals to access proper care. Shockingly, only 20% of people with mental disorders in Malaysia ever see a mental health professional. Why? Social stigma is a huge factor. Instead of turning to doctors, many Malaysians still turn to shamans or religious practitioners. More than half of psychiatric patients in Malaysia will first seek advice from traditional healers before even thinking about seeing a psychiatrist. That is a clear sign that traditional practices and deeply held beliefs still dominate the way people approach mental health, and that's why we must respect this view in order to help. In Malay culture, terms like gila, which means crazy or madness, carry a heavy stigma, discouraging anyone from even talking about their struggles. For many, mental health issues are seen not as an illness, but rather as a punishment or even a spiritual possession. And in Chinese Malaysian culture, mental illness is often viewed as a sign of lack of self worth, something linked to personal success, wealth, and family honor. If you don't measure up in these areas, it's believed that you've somehow failed. Moreover, Malaysia is a collectivist society. When someone has a mental health issue, it's not just their problem, it's the family's problem too. That sense of shame can keep people from reaching out for help because they don't want to tarnish their family's reputation. Further, there's a severe shortage of mental health professionals in Malaysia. In 2018, the country only had 1.27 psychiatrists per 100,000 people. That's a shockingly low number compared to other nations. On top of that, the health budget for mental health is just 1.3%, far below the 2.4% seen in upper middle class income countries. So not only are the people hesitant to seek help, but the system itself isn't equipped to support them even if they did. Underlying conditions, co occurring mental health disorders, and diagnosis complexity. Treating a muck is complicated, not only by the violent nature of the behavior itself, but also by the co occurrence of other mental health conditions, making diagnosis and treatment more challenging. Martin 1999 emphasized that accurate diagnosis is key to developing effective treatment plans that are tailored to the individual's needs. However, the complexity of diagnosing a muck, combined with the multitude of causes behind violent behavior, means there isn't a one size fits all solution. The challenge of diagnosing and treating violent behavior. One of the biggest hurdles is that there is no medication specifically designed to target violent behavior directly. In fact, developing such a medication is unlikely due to the wide range of underlying causes for violent outbursts. That said, Martin 1999 explains that certain psychiatric conditions that often accompany violent outbursts, such as depression, can be treated with existing therapies and medications. For example, depression, which is a common trigger for violent behavior, can be managed effectively through a combination of psychotherapy and antidepressants. In fact, antidepressants have been shown to alleviate depressive symptoms in around 85% of all cases. SSRIs and the role of psychotherapy. Given the dangerous nature of amok, Martin 1999 points out that selective serotonin reuptake inhibitors are frequently considered the first line of treatment. Why? Because they respond quickly, and serotonin depletion is a key factor in violent and suicidal behavior. By increasing serotonin levels, SSRIs can help reduce violent tendencies. But the treatment doesn't stop there. Combining medication with psychotherapy is critical, not just for managing symptoms, but for offering a broader support network. This is particularly important in collectivist cultures like that of Malaysia, where families' involvement is essential. Even outside of the culturally specific cases like amok, the presence of community support has been shown to positively impact a patient's well being. Tailoring treatment for specific conditions. When depression isn't the cause of these violent outbursts, the treatment approach for amok depends on other underlying conditions. For example, if psychosis is involved, antipsychotic medications are crucial. These medications can help reduce symptoms such as hallucinations, mania, and delusions, which are common in conditions like schizophrenia or delusional disorder. However, as Martin 1999 explained, antipsychotics are less effective in managing violent behaviors that stem from non-psychotic conditions such as antisocial personality disorder or borderline personality disorder. For these conditions, other pharmacological options are more appropriate. For instance, anticonvulsants may help manage violence related to mania, while mood stabilizers like lithium are proven to be effective for individuals experiencing mania or bipolar disorder. In these cases, hospitalization may still be necessary, particularly when patients pose a risk to themselves or others. Strategies for effective treatment and prevention of amok. As we dive deeper into the complexities of treating amok, we face a crucial question. How can clinicians effectively identify the root causes of violent behavior and develop treatment plans that truly meet the unique needs of each individual? We know that amok, while presenting in various cultures, has a wide range of underlying causes. But here's the kicker. While the symptoms may look similar across borders, the context in which it appears can vary drastically. So, what does that mean for treatment? Well, Ballara 2011 emphasizes the importance of understanding that while amok may appear globally, its presentation and manifestation are often shaped by deeply ingrained cultural beliefs and attitudes. The key here is not changing the diagnosis, but enhancing the treatment by recognizing these cultural nuances. By considering cultural factors, clinicians can develop more effective, culturally sensitive treatment plans that speak to the individual's lived experiences. This deeper understanding could pave the way for more effective prevention strategies. Raj et al. 2021 suggests a unique integration of cultural awareness into clinical practices. In Malaysia, for example, incorporating psycho-spiritual therapy could be a game changer. Imagine reinforcing core values like love, courage, truthfulness, hope, sincerity, and solidarity as part of the therapeutic process. These values aren't just ideals, they're powerful, deeply embedded aspects of Malaysian culture that can help reduce the stigma and improve mental health outcomes. Rather than imposing Western centric ideals, Raj et al. 2021 argues that clinicians should work with patients' cultural beliefs. This culturally attuned approach not only helps the individual reconnect with their sense of self, but also addresses the societal stigma surrounding mental health. After all, when patients feel seen and understood within their own cultural framework, they're much more likely to engage and stick with treatment. Ethical considerations when treating amok. As we delve into the complex world of amok, we are reminded that ethical considerations are crucial when developing treatment plans. Amok doesn't just present unique challenges in terms of diagnosis, it requires an ethical framework that ensures treatment is culturally sensitive and respects the individual's dignity. So, how can psychologists navigate these ethical challenges when working with patients exhibiting violent behaviors like amok? The Canadian Psychological Association 2017 offers a solid foundation for this process with principle number 1, respect for the dignity of persons and peoples. This principle emphasizes the need for psychologists to establish collaborative and constructive relationships with clients, treating everyone with equal worth. For clinicians treating amok, this means ensuring that each patient's unique identity, cultural, personal, and otherwise, is not only acknowledged but also respected. It's about ensuring that no one feels diminished or judged based on their background or behavior. By staying open to a patient's cultural story, therapists avoid imposing their own beliefs. Instead, they create a space where the patient's perspective is heard and understood. This approach allows clinicians to navigate cultural differences which is key to effectively treating and preventing amok-related violence. Principle 2, responsible caring, takes this even further, urging psychologists to always prioritize the well-being of those they treat. The core idea here is simple. The actions of a healthcare professional must benefit society or at the very least do no harm. In the case of amok, a condition that often leads to violence and sometimes suicide, this principle becomes crucial. Psychologists must ensure that their treatment plan is culturally competent, meaning it respects the patient's cultural beliefs and community values. The idea is not to force Western practices, but to integrate treatments that align with the individual's worldview. In cultures with strong community ties like Malaysia, this means involving community leaders, such as spiritual or religious figures, in treatment processes. These leaders hold significant influence in the lives of individuals and can play a crucial role in the healing process. Integrating these figures into therapy sessions not only honors the patient's beliefs, but also strengthens the treatment by offering support from trusted community figures. But what if the patient is too unwell to rejoin society just yet? Ethical Standard 2.2 speaks directly to this. Psychologists must use sound judgment when determining the most appropriate course of action. Should the patient remain hospitalized for further care or be supported as an outpatient? These are complex decisions that demand careful reflection, particularly when the patient's safety and the safety of the community is at risk. Alongside this, integrity in relationships, Principle 3, remind psychologists to be transparent, honest, and unbiased. It's easy to let personal biases creep into their work, especially when dealing with something as complex as amok, which can trigger strong emotional responses. Psychologists must therefore regularly check in with their own assumptions and values to ensure they are making objective, evidence based decisions. Reflecting on the methods they choose and being open about how their biases might influence their practice is crucial to maintaining trust in the therapeutic relationship. Finally, let's talk about Principle 4, responsibility to society. This principle ensures that psychologists use their expertise to advocate for social structures that benefit everyone in society. When it comes to amok, this means more than just individual care. It's about ensuring that policies, systems, and healthcare practices around mental health are inclusive and culturally competent. Psychologists must strive to make the healthcare system more equitable and open to diverse cultural needs. They also must be prepared to collaborate with the broader community, gather input from cultural leaders and individuals who can provide valuable insight into how to best approach treatment and prevention. The Canadian Psychological Association 2017 emphasizes that psychologists must be lifelong learners. They must continuously educate themselves about cultural, historical, and social contexts in which they work. By engaging with local communities and consulting with cultural experts, psychologists can ensure they're offering the most relevant, respectful care that they can. This approach to ethical care doesn't just meet the individual's needs, but it also promotes a healthier, more inclusive society.